That's a great question. Neur-ON is actually a very commonly known term. Neur-ON essentially means brain cell, but we didn't exactly choose this name in reference to that. We use it as an abbreviated form of neurorepair. Because we are a clinic aimed at repairing brain tissue, we are a neurorepair center. We are a center that focuses on aiming to protect every single brain cell and making efforts to do so as soon as the patient steps through the emergency service door. Because when we talk about rehabilitation, it is essential to do this on a solid background, which is a repaired tissue. The brain vessel needs to be opened and blood must flow back to that tissue in the brain for the entire repair process to begin.
Hello, I am specialist physiotherapist Saren Bayrak-Dortkol. Our Mobilita platform is designed to support conventional physiotherapy. Neur-ON Clinic is not just a robotic rehab unit, it is a platform with all evidence-based methods. Our platform features both the Omego and Lexo devices. We aim to restore walking function at the earliest time point using conventional physiotherapy and evidence-based exercise programs. The support of technology is essential here to boost repetition numbers and enhance rehabilitation effectiveness. At Neur-ON Clinic, we aim for the earliest short-term and frequent mobilization. Lexo is an end effector robot that operates via a foot support platform rather than the patient's legs, similar to other exoskeleton robots. This enables a more natural walking pattern. Lexo allows us to modify walking speed and weight transfer, providing a flexible rehabilitation option tailored to each patient. The Lexo device allows us to design a specific rehabilitation plan for each patient, whether they can walk or not.
Hello, I am physiotherapist Lyda Woos. Thyromotion Omego is a bicycle ergometer that supports early mobilization and movement recovery in lower limb paresis. Omego positions the patient safely upright and enables secure early mobilization by facilitating high repetition leg movements. For patients with restricted knee and hip joint mobility, joint range can be tailored and angles can be incrementally increased to aid in movement recovery. In addition, the goals of the treatment process can be determined by evaluating the sense of leg position. For patients still unable to stand, the Omego Push Power Test measures leg muscle endurance to kickstart their strengthening process. The ankle joint training mode is used to tackle frequent problems such as foot lifting difficulties and tripping that occur after a stroke. In conclusion, the game mode of Omego enables patients to engage in high repetition exercises while maintaining their motivation. Omego is a user-friendly rehabilitation tool that speeds up mobility recovery after a stroke.
Hi, I'm Hazal Kilinch, an expert occupational therapist. Ergotherapy is a health profession focused on assisting individuals in resuming daily activities after health issues like stroke that prevent active participation. In this area, we help individuals recover their motor skills with activities that are task-focused and repetitive, customized to their needs. We also boost the individual's quality of life by supporting cognitive and emotional well-being. We plan to begin these activities as soon as we can after the stroke, bringing technology support into daily life. Our goal is to enable individuals to rejoin their daily life independently. This system helps individuals learn natural movements with smart weight support and a 3D movement area, enabling one-sided or two-sided activities. By integrating virtual reality, this system boosts motivation and makes the treatment process significantly more effective. Our aim with Diago is to improve the upper limb function, which is often utilized for patients to engage in their daily activities.
Hi, I'm Ipek Erdogan, a clinical neurophysiologist. Our goal is to assist your recovery using the most up-to-date treatment techniques in our neuromodulation unit. In this clinic, we start neurorehabilitation as early as possible, meaning within the first week. The first month is crucial for us in the treatment window. The intensity and quality of treatments during this period are very important. But are task-oriented, intense, and repetitive exercises sufficient? Probably not. We think that the brain's damaged connection network requires reinforcement and renewal. Transcranial magnetic stimulation has become a crucial method for daily applications. We utilize it right before the physical therapy session. Transcranial magnetic stimulation is central to our treatment.
We use a device called Amedeo to enhance upper extremity functions for the fingers. Amedeo is capable of operating each finger individually. The magnetic connection system enables us to execute finger movements with precision and control. It helps them regain their gripping and releasing skills to activate flexor and extensor muscles. Additionally, it supports patients in adapting more easily to daily life by improving their motor skills with special treatment options like spasticity treatment and sensory training. It helps them adapt to daily life more smoothly. RecoverX is a brain-computer interface system that merges cognitive power with virtual reality. This technology enables individuals to manage upper limb motor skills via motor imagery. RecoverX aids in the recovery of these abilities post-stroke by enhancing neuroplasticity. It accelerates patients' rehabilitation processes, making them faster and more effective with real-time feedback and interactive tasks.
Hi, I'm Selin Ergasa, a neuropsychologist. Gaining early information about patients' cognitive or mental state before and after a stroke is crucial. This is important for developing personalized therapy programs and defining individual goals. In addition to an intensive therapy program, developing mental flexibility is also crucial for a person's independence in daily life. It's important.
Hi, I'm Alper Gökçe, a language therapist. Early assessment of speech and language disorders is critical for creating specialized treatment programs and setting therapy goals for individuals post-knowledge. Speech and language therapy aims to enhance patients' quality of life by supporting the recovery of communication skills. Therapy programs are customized for each patient due to their unique communication needs. Our goal is to ensure that patients actively participate in daily life and reintegrate into society.
Hello, I am Dr. Serkan Bengus, a speech and language therapist. I focus on the assessment and treatment of swallowing disorders that occur after a stroke. There are many complications that can arise, and among these complications, the leading cause of death is the presence of swallowing disorders. For this reason, early diagnosis of swallowing disorders and prompt initiation of treatment are extremely important. At our facility, we leverage technology to treat swallowing disorders effectively. In the treatment of swallowing disorders, it is very important to reactivate the swallowing center in the brain and restore cortical plasticity after a stroke. Alongside conventional treatments, our center employs central and peripheral simulation methods. For central simulation, we apply transmagnetic and direct stimulation methods. For peripheral stimulation, neuromuscular electrical stimulation therapy is routinely applied at our center. With our intensive and systematic treatments, we are making efforts to address patients' swallowing disorders at the earliest opportunity.
As a new kind of center, we have a variety of distinct and intense goals. We are present and ready to achieve them. Just a single step will connect you to us.